Dear students, the second sections of this course concern the contemporary human rights. The human rights, as it is known, as we know them today, were created by the United Nations in 1948. This was the first global understanding of human rights globally based on the history presented to you in the first lecture of this course. Out of 58 countries, not that it was only 58 at that period, because majority of the world was colonized and was not entitled to self-determination. Out of 58 countries, all countries voted for or abstained. None voted against. Those who abstained were the communist nation because Nazism and fascism were not namely condemned. Also abstained South Africa to protect apartheid, and Saudi Arabia, who didn't want freedom of religion. There are 30 human rights. I will not detail all of them. Remember, you cannot take or remove some because they are interdependent. If you do not have all 30, you do not have compliance with human rights. We have to ensure human rights are universal, regardless the race, age, sex, country, as detailed in the first part of this lecture. The rights granted by the Universal Declaration of Human Rights are the rights of the individual, such as the right to life and the prohibition of slavery. Remedies to defending these rights when violated are also included. There is also rights of the individual in relation to each other and so to groups, such as the freedom of movement, and the spiritual, public, and political freedom, such as the freedom of association, thought, conscience, and religion. The human rights can be divided in three categories. During the French Revolution, the motto was liberty, equality, and fraternity. So, based on these three words, liberty is linked to political and civil rights. Equality is linked to economic and social rights. And fraternity is linked to collective rights, since this is a community effort. So, by remembering liberty, equality, fraternity, you will remember the three categories of human rights. The right to healthcare is part of the economic, cultural, and social rights. The right to healthcare is not a single right to healthcare, but rather a set of rights that promote the highest standard of health services. The right to healthcare is exercised only if 14 specific other rights are exercised simultaneously. The right, for example, the right to clean water, to housing, to food, but also a right to assembly and freedom of movement. The right to healthcare is holistic and recognize the fact that healthcare is the production of a variety of social determinants. This is in its Article 12 in the General Comment 14. Where do we stand today? It is important to note that the Universal Declaration of Human Rights of 1948 has no force of law because it's an optional agreement that is not binding, but it is the foundation of two other binding covenants, meaning states may have signed the Universal Declaration of Human Rights in 1948 and not apply them. Nobody can make them accountable. But the Universal Declaration of Human Rights give two binding covenants, and if a country sign those two covenants, now they have to implement the human rights, and we can make them accountable of not doing it. So when these two binding UN human rights covenants are ratified by a country, meaning signed, and they have to pass it to their parliament, they have the obligation to respect the human rights, to protect the human rights, and to fulfill them. These two covenants are the International Covenant of Economic, Social, and Cultural Rights and the International Covenant of Civil and Political Rights. After ratification, the first step is to harmonize those two covenants with national laws. It is necessary to include the human rights internally within the law in each country. The concept of respecting rights indicates that the government will not violate laws supporting human rights issues. Secondly, the protection of rights involves governmental prevention of rights violation by the states and others, as well as the provision of sanctions when the rights are violated. Thirdly, fulfillment of rights means the government's active mobilization to realize human rights. The Universal Declaration of Human Rights, adoption by the United Nations in 1948, was at the time of colony, and the first country to be independent from European colonizer was almost 10 years after. This is an example of non-respect of the Universal Declaration of Human Rights, but also of the covenant signed by country. Another example, Nelson Mandela was jailed 32 years despite the fact that apartheid South Africa had signed the Universal Declaration of Human Rights. Another example in another continent is also why Martin Luther King fought and marched for racial equality, even 2 decades after the signature of the Universal Declaration of Human Rights by the United States. Human rights are not respected everywhere, even with countries who ratify all international legal documents. It is due to pathology of powers, such as some governments use and distort these rights or let powerful industries or other entities to do so. Another example is racial politics allow violation to occur for a portion of the population to not share the power with all. For example, the white power were violating the rights of other races for them and their descendants. And when human rights were ratified in 1948, most of the current developing world was still colonized, exploited, and abused all across the world. Ghana was the first country to be independent from European colonizer 10 years after the signature of the Universal Declaration of Human Rights in 1957. Many countries repurposed human rights to sustain power, hierarchy, such as in some Swiss cantons that didn't allow women to vote before 1971. There were several global movements and realizations that helped change the paradigm of human rights, such as the right of people of color. For the right to health care, some diseases have changed the right to access medicine and services such as the fight to access treatment and care for HIV. These changes, most of the time, come from activists in civil society who go and move the world. The majority of the cases and deaths due to HIV were in Africa, but it was a global movement. Human rights need to be watched and protected because they are not permanent and are developed inconsistently. Even today, to protect a certain style of living, governments transform moral certainty into mechanism of oppression, terror, and murder that violate human rights of others. For example, Guantanamo Bay, it is ostensible use of laws to violate human rights in the name of safety. We need to permanently be vigilant because human rights can be used for its contrary. Read this. I'm going to read it with you. It is impossible to stand by and watch millions belonging to a great and ancient civilized people be denied rights by their government. I have determined, therefore, to place the help of our country at the service of these millions. Guess who said that? Guess. Hitler distorted human rights to his profit. So be always careful. Don't follow people because they have good speeches. Watch what they are doing and what they are up to. Healthcare is a fundamental right for all. The right to healthcare is the economic, social, and cultural right to an universal minimum standard of healthcare to which all individuals are entitled to. And it's detailed in international agreements such as the Universal Declaration of Human Rights, the International Covenant of the International Covenant of Economic, Social, and Cultural Rights, but also in other conventions, such as the Convention of the Right of Persons with Disabilities, and many other documents. This includes access to timely, acceptable, and affordable care of appropriate quality and includes freedom and entitlements. Entitlements include the right to a system of health protection that is equitable. Freedom are the right to control your health, meaning for adults, consensual treatment, an appropriate explanation about it, and for children, parental decision, except when through a judicial system, it is done without parents' consent for the best interest of the child when the parents are putting the child in danger. This process needs to legally destitute them as parents from their authority, the parental authority. Freedom is also the right to control your body, your sexuality and reproductive rights, and the right to participate in health policies that concern you. We always need to remember that everywhere vulnerable and marginalized groups are less likely to have their human rights respected, including the right to health care. Most fatal communicable diseases such as malaria, HIV/AIDS, and TB disproportionately affect the world's poorest population. Same for non-communicable disease at younger age. Within countries, some populations like indigenous communities have greater rate of ill health and are less likely to have access to quality and affordable care. Today, we can count many violations of human rights to health care, such as the case of people with mental health disorder who are kept in mental institutions against their will when they have the capacity to make decisions regarding their life on a day-to-day basis and their future. In that case, it shouldn't happen. It is also the case of women who are denied access to sexual and reproductive health care, forced to early marriage, or on contrary, into procedures such as sterilization, abortion, and virginity examination. This happened today. Human rights-based approach to healthcare for patients and providers need freedom to discrimination, availability of services when it's needed, accessibility to receive care on time that is affordable. This concerns cost, but also distance. Acceptability according to culture and privacy. Quality standard of healthcare services, of working conditions for providers. Accountability, protect against malpractice. Universality, meaning for all. There is a responsibility of all sectors, all workers in all fields, and some scientists and researchers and publishers forget that. See what was published in a famous scientific journal. Look here at the recommendation being made by a scientist claiming that it may be best to let Rwandan children suffering from diarrheal disease to succumb to this killer. According him, using a simple evidence-based tool such as oral solution for rehydration, meaning water, sugar, and salt. That's oral solution for rehydration. It was not worthwhile because these children were only promised to a miserable life if they was to survive their diarrheal disease. And diarrhea disease was among the top killers of children below the age of 5 at that time. So it was promoting the denial of the human right to live for Rwandan children. And this was not so long time ago, 20 years ago. And it was published in The Lancet. Just because researchers, scientists, and publishers in this case didn't take the responsibility of respecting human rights, they allowed the promotion of the idea that Rwandan children should be let to die if we had a simple solution to save them. For the link between One Health and human rights, it's very important to note that the Human Rights Council appointed an independent expert on human rights and environment. And there are many reports that has been issued to guide us, such as the mapping report in 2014, the good practice report in 2015, climate change report in 2016, implementation report in 2016, biodiversity report in 2017. So I would like to insist that you always make your own judgment, guided by leaving no one out, and that all life matters. International institutions recommend different investment in the life of people according to the place where they are born or live. That means WHO recommend that the life of an African has less value than the life of an European. That means that when you are coming from a developing country or a poor country, your life value so little compared to the life of somebody coming from a developed country. Look here, WHO recommendation about cost effectiveness is to spend no more than 3 times the GDP per capita. Previous slide, please. That you spend not more than 3 times the GDP per capita. This means that the human life has different weight when comparing a poor country to a rich country, because the GDP per capita depends on the socioeconomic situation of the country. For example, here I am with the former director of the World Health Organization in 2010 in New York. If we had the same health problem at that moment, according to WHO recommendation, it would have been okay to spend only $2,500 on my healthcare, but you can go up to $250,000 to Margaret Chan. So that means if we had a serious issue, you are ready to let me die and to save Margaret Chan. Here on the photos, and this simply because of the Rwandan GDP, where I'm living, and because of the Switzerland GDP, where she was living. This is a denial of the right to live and the right to health care. So always make your own judgment on international guidelines you receive, coming from Anyway, when assessing the respect of human rights in a country, it is also necessary to ensure impartiality, because conflict of interest must be avoided. We need to make sure that the people who are evaluating these human rights are independent. If not, we may face manipulation. I advise you to take note or to ask the contact or the link to this video who shows you how human rights organizations have been manipulated for the interest of some rich countries. In all countries who sign the Declaration of Human Rights and the Covenant, there are commissions of human rights to watch the government and to report on the action of the government. But often there's entities that should make the government accountable for the application of the universal human rights are weak. So we are reaching slowly the end of the lecture. And as a wrap-up, I would like to tell you that the majority of the world agree that healthcare is a human right. And the majority of the world has signed the Universal Declaration of Human Rights and the legal instrument that make their implementation mandatory, the two covenants. We also know that all human rights are universal, interconnected, interdependent, and none of the rights can be removed. We know also that there is a pathology of power, of powerful entities, industries, governments, that abuse their power and deny the human rights of groups of people. We also know that international human rights law are valid in a country when they are included in national laws. And this is the place where citizens can act. We also know that so far, no country fulfills all human rights. It is for all countries a work in progress. We know also that we have to proactively search the marginalized and the vulnerable to help them to fulfill their human rights to health. If not, they will not fulfill it. And this is all what it means when we educate you to leave no one out. Dear students, we have reached the end of this lecture. We learned that human rights that have been agreed on need to be watched, protected, because they may disappear. The series cylinder reminds us that it's about a permanent vigilance. It may exist today. If we don't protect the human rights, they may be removed one by one. It is important also to understand that as human rights are implemented by being integrated within the laws of each country, we all have a responsibility. Thank you.